By the data, it's clear the battle against COVID-19 is far from over.
And right now, we do want to welcome Onondaga County Health Director, Dr. Gupta, to talk more about our current situation. And also, we'll take a look back at the past 2 years. Dr. Gupta, thanks so much for being here tonight.
Thank you for having me.
All right, let's first look at the numbers right now. Central New York's 7-day positivity rate, it's back up above 5%, the highest in the state. Same when you look at cases per 100,000. Why is that, and what's being done to bring those numbers down?
So we remain to be hovering around about 5-6% or so for the last several days. These are the ones which get reported through the lab system, and there are many people who are actually doing the home testing and not reporting those. So we don't have the right denominator, and then when you do start calculating, unless you have the right denominator, you can't actually say that what is the actual positivity rate. However, the concern, as you pointed out rightfully, that we still have that high positive rates at this point. That means the COVID is still within our community, and we still should be practicing those public health measures, which we have learned from the beginning of pandemic. Use the mask appropriately. If we are in indoor setting, I know the mask mandate has been out. Doesn't mean that people need to leave it out of their lives. I personally, when I go to any grocery stores or somewhere where I'm not familiar, I'm going to keep the mask on. And hand washing and testing and vaccination. These are the so many tools which we have. Certainly, that's what we are trying to promote at this point. People are moving around a lot. They are congregating together. So that is certainly is going to be the reason for continue to have a little bit somewhat higher rates of transmission in there. But what we can do is we can control it. How? By testing. It's widely available. As you were pointing out, in 2020, we were struggling to find the right test. Now we have so much widely available testing in the community, both PCR testing as well as the rapid testing, home testing. So people should test. Why? Because the testing, you can protect yourself, you can isolate, you can quarantine your family, and then also if you need treatment, certainly that's the only way you will get to the treatment, whether it's a monoclonal antibody or 3 antivirals. These are so many good tools, and plus on top of it, the vaccines. Vaccines are saving lives and will continue to do those. So we certainly are going to ask people that look at these numbers, get tested, get vaccinated, and use all those tools in your toolbox to keep yourself safe, because pandemic is still here in this world at this point, including in our community when we continue to see those cases.
But Dr. Gupta, is the messaging right now? Because we've dropped all the mask mandates. Everybody pretty much is convinced that, we're through this thing. We don't need our masks anymore. You're saying we could still use masks. We need to wash our hands. We need to
Correct.
take this seriously. Do we need to mandate masks indoors and back at schools again to get this thing under control?
Right. So at this point, we are moving away from the mandates, whether it's at the level of CDC or whether it's state level or the local level. The burden is shifted from having from the mandate to individual responsibility. It's like trying to make that, would this COVID be part of our day-to-day life for some time, will become like a seasonal disease like the flu is. So how can people protect themselves? By learning from all the tools which were there. We have wide tests available. Masks are so critical in spreading the transmission of virus. We saw that. So masks are not mandated, but it does not mean that they should not be used. I have that right here, right? So when I go out, when I leave this office, when I'm outdoor, I'm not going to use that. But if I'm in certain areas, if I go grocery shopping or within some indoor setting, I certainly are going to keep my mask on, because there is a virus still out there. So all those tools, which is my personal responsibility, is going to really dictate me how I am going to protect not only myself, but my friends and family. And that's what I'm asking everybody to do so. Because if we want to put this pandemic behind in some shape and form, we need to work together. The mandates did their job at this point, but at this point, we should take care of ourselves and our community by learning from those and continue to adapt them in our daily lives.
Got about a minute left, Dr. Gupta. Why does contact tracing seem to be a thing of the past?
So it is literally thing of the past that's not actually thing of the past. People should be doing within their own. For example, if your family or friends, if you got positive, right? If turn become positive, then I should contact all the people who I can trace my path and then say, who did I might have exposed? And that is again become our responsibility. So organizationally, we as a local health departments are not doing it. Schools are not required to do that. We encourage them to make sure that they know where the student or staff's path has been, because that's the only way you can quarantine those individuals voluntarily. At this point, that's what it is. And have the new emergence of cases to break the transmission of virus. So these things are not mandated, but they are the good public health practice, and we should continue to do that actually as we continue to move in 2022.
Dr. Gupta, I know it's hard to do in 30 seconds. 2 years. What's it been like for you, your health department, over these past 2 years?
It has been a roller coaster, from the highs of the emotions when the vaccine came first, and you see the pleasure and gratitude in people's eyes, you know, even though they were masked, and then lows when we had to announce the first death, or so many deaths who were preventable. The people died because there was no vaccine at that point. And then when you see the families lost their loved one, you know, those are the lows. And then the highs was that there were so many medications came out, so much treatment came out, and then we know so much more about this pandemic at this point than we did before. So there is hope. As we are going in 2022, I want people to remember that science gets a lot of answers, but doesn't get all of them. We need people to work together to address this pandemic, which they are doing it. And there is a hope, but at the same time, there is a vigilance. People should really be careful about that, because pandemic is still there, and get vaccinated, get tested, and feel good and be happy and stay in present. That's what my message would be.
We always appreciate your guidance. Thank you so much for joining us tonight, Dr. Gupta.
Thank you.